why do you think so many people in underserved communities face disparities in healthcare?
Yeah, as you know from a lot of your prior work as well, folks within underserved communities, predominantly minority communities, have less access to healthcare, and that access may come from having less access in terms of seeing a nurse or a physician when they're sick, but it could also come in the form of having less access in terms of information around making healthier choices and opportunities to make healthier choices so that they don't get to the point where they're actually battling a disease process. So I think the issue of access is paramount in looking at the issues of underserved communities. And as you pointed out, what we're trying to do is to figure out how do you best use technology to address some of these issues facing some of these underserved communities.
Right, definitely so. And I emphasize as I talk to people that we're now absolutely in a digital world.
We are.
And so anybody who doesn't understand that in the health field has to get with the program, as they can say.
That's true. These technologies are a part of our everyday life now.
That's right.
People are using it to figure out where to drive and, what to do next and so forth. So what if we could use these technologies to make people healthier and have them just incorporated as part of their daily life? And so that's where the opportunity with this kinds of activity that we're funding, but also a lot of other things going on in the country, that's where the opportunity lies in terms of technology and healthcare.
Yes, definitely so. Now, and of course, I guess we'll talk a little bit about the digital divide, although in my experience and from what I know from the Pew Research Center, the digital divide is narrowing.
Yeah.
Except that we in the health field have not given enough focus to providing health information technologically so that people can get the messages they need to get.
Yeah, no, you're exactly right. The divide, especially when it comes to handheld devices and those kinds of things, mobile phones has rapidly kind of shrunk, and now many minority communities are using these things at a faster rate compared to the rest of the population. So there's a lot of opportunity, and as you just pointed out, the question is, are we taking full advantage of those opportunities to make people healthier?
Right, definitely so. Tell us a little, I want to come back a bit to talk about several things that I'd like your comments about, but tell us first about your World Innovation, your Healthier World Innovation Challenge.
Sure. So this challenge is we're trying to identify smart people across the country who are dedicated and passionate about working with many of these underserved communities, and we want to fund those individuals at around $750,000 over 3 years to go into these communities and work to help improve their health outcomes. So we want to provide some of the financial support to kind of bring the best minds to deal with some of these very challenging local issues.
Right. Okay. That's very important. And of course, I think the other thing that's going to be very interesting is how you bridge community-based activities and we can call digital interventions.
Yep.
and digital communications.
Yeah, because at the end of the day, it's, the digital whatever we use is just a tool. The impact and what people do differently is really the outcome that we're trying to get to.
Sure, definitely so. Now, how's the program going to work? Can you tell us a little bit more about it?
Mm-hmm. So if folks go to our website at aetnafoundation.org, AETNA foundation.org, all one word, and they click on that, they will see information about how to apply. And we'll be accepting applications up till around the middle to late of February. And then, if there's a right mix, then we would fund these individuals, as I said, at a rate of around $750,000 over 3 years. And the goal would be to, fund people who can build community partnerships and then improve health outcomes within these communities.
Right. So when you mentioned the $750,000 over 3 years, is that for consortia or groups of organizations,
It could
or
be.
for lead organizations?
It
How is
could
that?
be. It could be. However, you want to structure it as the grantee. You could pull together a bunch of people, or you could try to do the work on your own with having linkages to the right kind of community linkages. So it could work. It could. It all depends on how you propose it in your application to us. But there's a lot of different options that folks should be open to.
Okay, and I want to mention a couple of other things. First, cross-linking and multiple channels of communications, even with the smartphones. The issue becomes how you get the social media piece in there,
Yeah.
and how do you get how you get them to the website for
Yeah.
more substantive information and so forth. And I'm impressed that community-based organizations, by and large, even have more challenge than somewhat larger organizations
Yeah.
because they've sort of not been involved with digital communications at all as it relates to health.
Yeah, you're right. They might have challenges on that end, but one thing is many of these community-based organizations have great relationships and grassroots tentacles, so they can reach people with the right kinds of information. So, there's a lot of different ways to partner. At the end of the day, the partnership should lead to some change in a local community.
Oh yeah, listen, I'm very much an optimist in terms of what you're discussing. Let me ask you one other thing that I think our audience would want to know about. Being that it's the Aetna Foundation, would that mean that only nonprofit organizations would
Yes.
be applicable?
Yes. This is mainly directed toward nonprofits, community-based organizations, churches, academic institutions, and things along those lines. So it's mainly directed towards nonprofit organizations.
Okay, but have you thought of, and of course you and I can talk after this, but have you thought about what I can call cross-auspice, combinations of for-profit and nonprofit organizations together?
Yeah, I think if there is a linkage where, the private sector company made that linkage with the nonprofit to develop this, we would certainly be funding the nonprofit as the primary
I
grantee.
understand that, but I understand that, but I'm just saying there's much more digital expertise at the moment, probably in the for-profit sector.
Sure.
I just wouldn't want you automatically to limit it to nonprofit.
Yeah, no, there is a lot of expertise in the private sector for sure.
Okay, well, so is there anything else you want us to mention? People are going to be able, let me recap. They can go to the aetnafoundation.org website. That's all probably lowercase, but certainly it's one word altogether.
Yep.
And they'll be able to get information about the applications, how to get an application, how to complete it, and how to get help.
Yep.
And your grants are going to be $750,000 approximately over a 3-year period of time.
Yes, exactly.